Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the tumors of kidney, urinary tract, renal carcinoma and management. Renal carcinoma. Renal carcinoma is the common tumor of the kidney, previously called as the hypernephroma. Symptoms. Hematuria is the commonest symptom. Renal colic. The pain in the renal angle occurs due to the clots. Sometimes there may be vague abdominal pain. Fever. The pain may be responsible for the long continued fever. Metastasis. Patient present with symptoms arising from metastatic foci in the lungs, liver and bones. Polycythemia. On rare occasions, polycythemia occurs and it is believed to be due to excess production of erythropoietin. Diagnosis of renal carcinoma. It is suspected from the history and the tumor may be palpable. Radiological investigation is essential and aortography may distinguish the filling defect from that due to simple cyst which is avascular. Treatment. Early surgical treatment is the only prospect of cure. Nephroblastoma. It usually occurs in the first decade or particularly in the first year of life. It is the second commonest malignant tumor of the kidney. The tumor is the radiosensitive. Treatment. Best hope of cure is early diagnosis, surgical removal and followed by radiotherapy. Tumors of renal pelvis, ureter and bladder. The tumors of renal pelvis, ureter and bladder are histologically similar and are almost always transitional cell carcinomata. They usually spread locally and direct invasion and implantation to other parts of the urinary tract. Some tumors are benign like papillomata. All tumors of the urinary tract are liable for recurrence even after adequate treatment. The bladder is the common site and studies have shown that it is particularly likely to develop in patients who work in industries where exposure to aniline is likely, such as dyeing and printing. Symptoms. Hematuria is the sole presenting symptom. Obstruction features to the urinary tract also occurs. Symptoms of urinary tract infection may be superimposed. Diagnosis. Diagnosis is confirmed by the cystoscopy, radiography and biopsy. Treatment. Treatment is the surgery only. Cystectomy with transplantation of ureters to the colon or skin may be necessary. Prostatic carcinoma. Prostatic carcinoma usually presents with symptoms of urethral obstruction similar to those of benign prostatic hypertrophy. On digital examination of rectum, the prostate is felt to be very hard and the medial furrow may be obliterated. Spread. Spread through the capsule and metastat in the bone occurs and are often associated with a rise in the serum phosphatase. Treatment. Both the primary growth and the metastasis can be controlled with estrogens like dinestrol. Gynecomastia is the side effect of the drug. In some cases, orchidectomy may be necessary. Testicular tumors. Tumors of the testes are rare but are usually malignant, spreading to the lungs at an early stage. A seminoma presents as a painless and often rapid uniform enlargement of the testis, and the teratoma cause nodular enlargement. Some teratomas produce gonadotrophic hormones and cause gynecomastia. Treatment. Treatment is the orchidectomy and radiotherapy. These are radio-resistant. Prostate gland benign enlargement. It is found in men over the age of 60 years. It may be associated with the fall in secretion of androgen. The enlargement of the prostate obstructs the outflow of urine from the bladder by compressing, displacing, distorting, or elongating the prostatic urethra, results in action over the bladder and the renal function. Symptoms: retention of urine, hematuria, bleeding from urethra. Diagnosis: rectal examination shows that the prostate is large, elastic, uniform in consistency. When median lobe alone is affected, the condition can be recognized by only cystoscopy. Treatment: prostatectomy. Acute retention is relieved by catheterization and watched for a few days. After removal of the catheter, if there is retention of urine, surgery is performed in a few days. Type: that's all about the tumors of the kidney and urinary tract and management. And in the next video, I will discuss about some other disease. Thank you.